What does lymphoma fever mean? Imagine feeling a low-grade fever that just won't go away, even when you haven't been sick or exposed to an infection. That's often what people with non-Hodgkin lymphoma experience. This kind of fever is called a lymphoma fever, and it usually means something is happening inside the body related to the disease. Unlike fevers caused by colds or flu, lymphoma fever is often mild but persistent, coming and going over days or weeks. It's not caused by an infection but by the lymphoma cells themselves. These abnormal cells can trigger the immune system to release chemicals that raise the body's temperature. This type of fever is part of what doctors call B symptoms, which also include night sweats and unexplained weight loss. When you have lymphoma, your immune system is affected because the disease causes the production of abnormal white blood cells called lymphoma cells. These cells can weaken your immune response, making you more vulnerable to infections. Sometimes, infections can cause high fevers, but lymphoma-related fevers are different because they happen without any clear infection present. The key thing to remember is that if you experience a low-grade fever that lasts for more than 2 weeks and you don't have an obvious reason like a cold or flu, it's important to see a healthcare professional. Persistent fevers can be a sign that the lymphoma is active or progressing. When combined with other symptoms such as swollen lymph nodes, night sweats, or weight loss, a fever can help doctors in diagnosing or monitoring the disease. It's also worth noting that because lymphoma affects the immune system, it can sometimes make infections more severe or harder to fight. So, if someone with lymphoma develops a high fever, it's crucial to get medical attention promptly to determine if it's an infection or related to the lymphoma itself. In summary, lymphoma fever means a mild but ongoing rise in body temperature caused by the disease process of lymphoma, not by infection. It reflects how the disease impacts the immune system and can be an important clue for diagnosis and tracking how the disease is progressing. Always consult a healthcare professional for personalized advice if you notice unexplained or persistent fevers.